and most of the time the overweight is the obesity, morbid obesity around the stomach and the abdominal side. Another important feature of the PCOS is acne. Because they have more male hormones than female hormones, the sebum or skin oils of all tissue were increased and causes blocked pores and more acne around the jawline, arms, and chests. Another feature is alopecia or female pattern baldness, also because of the excess in male hormone. Thinning or loss of hair is usually contained to the top of the scalp, but in several cases we can see it in front of and on the hairline in the first part of the scalp. Another symptom is dirty skin or which named acanthosis nigricans. This situation cause high brown black rough patch around the neck and underarms. Sometimes we can see migraines attacks because of the fluctuation in hormonal with light sensitivity, nausea, dizziness, and headache. When we do blood test, we can see increase in LH or luteinizing hormone, increase in testosterone levels, and DHEA, androstenedione. Those are male type hormone, and decreasing in follicular stimulating hormone. Estrogen level sometimes is high also. Also, we should check the thyroid stimulating hormone, prolactin level, glucose level, and insulin levels. We have a typical picture in ultrasonography evaluation. There is a large ovary with several small cysts, and the typical form is necklace-like. They are like pearls around the ovary. If we see 12 or more follicles measuring 2 to 9 millimeter in diameter and decrease and increasing in follicular volume more than 10 centimeter, and the stroma or connective tissue in the ovary is higher than normal, the diagnosis is also most of the time accurate, and the diagnosis is most of the time a PCOS. But if we have a follicle more than 10 millimeter in diameter, we should repeat the scan in another cycle. If we see the picture of the PCOS in one of the ovary, it's enough for the provided diagnosis. And also there is a familial history. We can see this feature in the sisters, in mothers, and the aunts and other relatives. And by providing personal history, the diagnosis is more valid. Another important aspect of the PCOS is the genetics basis. Because there is a strong evidences of the genetic basis for the polycystic ovary disease, so there isn't any preventive method. But early diagnosis and intervention could prevent from obesity, metabolic syndrome, diabetes mellitus, and vascular disease, and the prevention also is better than treatment. As I mentioned before, a huge number of the PCOS patients experience infertility. If the patient have overweight, and the BMI is high, she must initiate her fight with the PCOS by reducing about 10% of the first body weight and reducing the BMI. For the ovulation induction in infertile people, we try clomiphene citrate. But if there is hyperandrogenism, we should add some corticosteroid or another steps to cope with the problem. In patients with sugar or insulin abnormality, metformin can be prescribed. For those with the hyperandrogenism signs, cyproterone acetate or spironolactone or finasteride can prescribe. And for menstrual regulation, medroxyprogesterone acetate or dydrogesterone could be used. In future, we will talk more about the PCOS, and if you have question, you could ask your problems, your question to Dr. Pourmatroud. This is DrPourmatroud @gmail.com. Be healthy, be safe,